Hi, good morning Berlin. My name is Mihiraa. I'm your invigilator for the OIT speaking session on the 28th of June 2023. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Berlin Vince.
And, can you confirm your candidate number?
Sure, my candidate number is 2408248.
Okay. Are you taking this test as a nurse?
Yes, I am.
All right. Can I see your ID, please?
Sure. Here it is.
Okay. Thank you for the verification. Now, let's move on to the warm-up sessions. The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Would you be known as a nurse?
I would like to be respected as a nurse. I have the dignity of being a nurse. Being a nurse makes me proud, and I want to be recognized for my competence and productivity. I value the highly professional nature of my relationship with my colleagues, and the ethics I demonstrate in my profession.
What strategies would you employ to effectively motivate your team as a nurse?
My interpersonal style is to motivate others, especially when I was the supervising staff. My strategy of managing projects or leading teams of coworkers is to constantly encourage everyone to give their best. I praise those who do well and teach those who are new to the job. I use every opportunity I get to educate my team and colleagues. Constant learning helps me to evolve such a character in me.
What are the situations that make you angry in nursing?
One situation that makes me angry in nursing is when I encounter rude or aggressive patients or relatives who do not appreciate our efforts and care. However, I always try to remain calm and professional and use coping strategies and communication skills to resolve the situation. I understand that they are acting out of fear or stress, and I do not take their behavior personally. I also seek support from my colleagues or supervisor if I need to.
What are the qualities that people most often criticize about you as a nurse?
One of the qualities that people sometimes criticize about me as a nurse is being too much of a perfectionist. I tend to expect very high standards of work from myself and get stressed out in the process. However, I am always willing to improve my personal and professional growth and learn from constructive feedback. There are no ongoing or major issues of criticism that I face.
What are some of the most difficult decisions you have made in nursing?
One of the most difficult decisions that I have made in nursing was when my supervisor in the previous hospital quit without prior notice. When the management asked me to take over the position, I agreed without any hesitation. Even though it was challenging to manage both the clinical and the administrative work, I was able to rearrange the department workload to cover the position until a replacement was hired.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patient, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No, Mihiraa.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you, Mihiraa.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Thank you, Mihiraa, for allowing me to assess your husband, Henry. If you don't mind, shall I ask you a few questions regarding your husband's care?
Sure. You may proceed.
Thank you. Could you please tell me how he has been managed after the discharge?
Yes, after his discharge, I was on leave from work. And I managed so far, with my professional commitments as well. But it is not possible anymore. So recently, I joined back to my work.
I really understand your situation, and I appreciate your decision. By the way, I would like to know how Henry is coping up with the change.
Nurse, thereafter, I have been trying to give the best possible care for him, even in my absence. I have put a fridge and microwave in his bedroom, and keep meals out every day, so that he can eat when he feels hungry, but I am worried that it is not enough. Henry needs more care and attention.
I understand your concern, Mihiraa. Being a wife and a breadwinner who works full-time is quite responsible. However, I am sorry, from my assessment, what I have to inform you is that your husband is in a stage where he needs continuous monitoring and round-the-clock assistance, as well as care.
I was expecting this. To be frank, I knew that eventually he would need more round-the-clock support, but I hoped it wouldn't be so soon. Now, I am confused. I have no idea what to do.
Your state of being confused is sensible. Though, it's time to act on his needs, rather than feeling helplessness. Mihiraa, I will put forward a few suggestions, and see which will be best suitable for you.
Okay, nurse.
I know that what I am saying is not really acceptable. Nevertheless, I would suggest you quit your job. Or else, I recommend you to appoint a full-time carer at your home to take care of your husband. Another option is to shift him to a nursing home. What do you think is the best possible way?
Oh, no. I won't give up my job. If I quit, we don't have any options to live.
Yes, I understand your situation. Then, it is better to go with a full-time carer, isn't it?
Yes, what you are opting for is a good suggestion, but I cannot afford a full-time carer at the moment.
All right, then the best possible solution is a nursing home, where your husband can get 24/7 services within a nominal service charge. Does that sound good to you?
Yes, a nursing home could be a great option, but I wonder if my husband agrees or not. He hasn't stayed anywhere out of the home.
I acknowledge your point. I think you can manage it. However, choosing a nursing home won't be a wrong decision. All the nursing homes consist of experienced staff and high-quality services. Most nursing homes have specialized doctors to deal with emergencies as well.
I truly admire your words. If you don't mind, could you please tell me how to choose the best nursing service, if he is willing to join?
Of course. I am glad to help you with this.
Thank you for your willingness.
Mihiraa, first of all, you should prepare your list of requirements, such as his medical requirements, diet plan, private room required or not, and other preferences he has. Is that clear for you?
Yes, I got it.
Then, you should either visit some of the nursing homes, or make a call to them, and have a talk with the staff over there.
All right.
Thereby, you can get a detailed picture of the nursing homes. I hope you can do it without much hassle.
Yes, sure. Definitely I can.
Great. And finally, I would recommend you to find a nursing home in your local area, so that you can visit your husband whenever it is possible.
Oh, yes, that is a good idea. So, I can visit him often.
Yes. Also, there are nursing homes without time limitation to the visitors.
That sounds good.
Well, Mihiraa, keep all these points in your mind, and find a nursing home that is most suitable and friendly, alongside the care and facilities.
All right. I will do the scrutiny, as you said.
That's perfect.
Anyways, before proceeding further, it's important to get permission from my husband.
Yes, that is the most integral part. Without his will, we cannot take him to a nursing home, which is considered against the nursing home policy.
Okay, I got it. Well, I will discuss these things with my husband, and let you know shortly about his opinion.
Sure, take your time, Mihiraa. But, not so long.
I understand that. Thank you, nurse.
You are welcome. By the way, please give me a call when you make a decision.
Sure. Thank you.
That is the end of your OET speaking roleplay. All the best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.